Good morning, everyone. So I am on my way to a doctor's appointment. I'm going to take you guys with me today. So I talked a little bit about this in the Clean With Me video that I shared on Monday, but pretty much I'm going to my OB to get some results from some testing that I had done over the summer. There are a few things going on and why I'm sort of looking more into this and why the doctors want to look more into what's going on. You guys know I just recently found out I have a heart condition. I have a congenital heart condition called a bicuspid aortic valve, pretty much where my aorta has two flaps, I guess you could say, instead of three. So it just makes the valves work a little bit harder, and it can weaken the valves and everything. And so that's part of the thing that we need to look more into. We really want to look further into the safety of pregnancy with my heart condition. I'm going to be going to a maternal fetal specialist at some point for them to evaluate the safety of me carrying a pregnancy with my heart condition. But at the same time, when I went to my OB over the summer, they mentioned that I do have a fibroid in my uterus, and I don't know exactly what the size of it was. When we miscarried a couple years ago, I was able to learn a little bit more about the fibroid at that point. And at that point, it was like 5 centimeters, I think, maybe. And then after the pregnancy, it actually decreased. So I just went in and had an ultrasound to look at the size of the fibroid now, looking at the location of it and what type of fibroid it is. And then possibly at some point, I might need a surgery to remove it, depending on everything that the doctor says today. So I'm a little nervous, but I'm excited to just get some more answers and figure out exactly what I need to do. So, all right, I will check back in with you guys after I leave the doctor's appointment, and yeah, I will talk to you guys soon. So I am just getting back from my appointment right now. You can probably tell I'm kind of sad, sorry. So I just wanted to stop here and talk with you guys about how everything went, and just let you know sort of where it's all at right now. So I went and I met with the doctor. In terms of the fibroid that I have, he said that it's stable. So it is 5 centimeters, I think, is what he was saying. And it hasn't really changed a lot. I know when I was pregnant previously, it was it had decreased a little bit after the pregnancy, but it's been pretty stable at 5 centimeters now. And he said that right now, in terms of anything that I might need to do to help with that, that for fibroids, and again, I'm not a doctor, this is just my understanding, this is not medical advice or anything, but in terms of the fibroid, he said they pose an issue depending on where they are and what type of fibroid they are. They can pose an issue with fertility, and so pretty much in terms of what we would have to wait and see if there was a fertility issue for there to be anything that they would need to do with the fibroid. So that's good. I was thinking that I might have to have surgery at this point, and he was saying that he didn't think that was going to be something that was necessary. It would maybe be something to look into if there was a struggle with fertility. But that's pretty much everything for the fibroid. I guess what's kind of hard is that when we were talking, I was talking to him about everything and the referral to maternal fetal medicine, and he was just sort of giving me a little bit of information on kind of what to expect and kind of his understanding of risk and everything at this point. And he was saying that for me, with my specific condition, the bicuspid aortic valve, the risk can be part of the it's in terms of the diameter of your aorta, that kind of determines a lot of the risk when or the level of risk when carrying a pregnancy. And he was pretty much saying heart conditions can be extremely dangerous when carrying pregnancy, which I understand. And he said, he pretty much was saying best case scenario, this would be a high risk pregnancy, and it's terrifying. He was pretty much saying like, if once I go to the maternal fetal medicine office, once I go to the once I go to the once I go to the specialist, the maternal fetal medicine specialist, that, you know, they'll give me like a risk, I guess, or not even a risk, but like they'll give me like a, I don't know, probability or percentage of risk kind of, for my specific condition and my, you know, body and everything. It's hard to describe. Like they'll say this is, you know, the amount of risk that we believe that you would have carrying a pregnancy, I guess, if that makes sense. You know, but he was just pretty much saying like, even, you know, like regardless, this will be a very high risk pregnancy. You know, he was saying like your care would probably not be able to happen at the office. My care would probably not be able to happen at that office. I would have to go to the specialist and be like constantly monitored. Additionally, because this is a birth defect that I have, it's also possible that I could give it to a baby. And it's I just don't know. I'm overwhelmed, I guess. I'm scared. I don't want to give a baby a heart defect, you know. Finley's just lifted up his head and he's looking at me. I'm okay. You know, I don't want to pass on a heart defect to a child, and I also, you know, I'm scared of being high risk, you know. He was saying like, he was saying like heart conditions during pregnancy can be very, very, very dangerous. And he was saying, you know, like, our main concern is you. He was saying like, if it's on like the safer side, I guess, of risky, that, you know, I would need to have my care probably through that office, and I would need to be continually checked and monitored. And, you know, he was pretty much saying like, we need to have a plan in place for you. You know, he's like, we need to be very thought out. It needs to be very like, just very organized, and know everything, all the pros and cons and everything. And it's just hard because, at least for me, like I always thought at some point, like I would be a mom, you know, and like I've always thought about like myself being pregnant, you know, and like I bought maternity clothes and everything. And I know that there's like, I know there are other options, I guess, like, so I'm just sort of thinking like, okay, adoption, you know, surrogacy, but even surrogacy, like, you can't, like, I could still give the birth defect to the baby, you know? And so I'm kind of just like, I'm scared about the risk, but I'm also just like, what do you even do? Like, how do you look at a situation like this knowing how risky it is and just jump right into that, you know? Like, I don't know that I can, you know, I don't know that I can just say, okay, like, there's this much risk. It's terrifying, you know, like, I'm just scared and I'm sad, like, because like, so say we don't even, you know, say that we say, okay, pregnancy's not an option, like, we can't even do surrogacy because I can't give this to a baby, and then like, I don't get to, sorry. And then we, you know, don't get to see and have like a little baby Sean and Kieran, you know? And I know there are so many other kids in the world that I could adopt, but it's almost like mourning that loss of like our baby, you know, like what it would be, what it would look like. It would be so cute. I think. I'm like, oh, the baby would be so cute. I just think it would be cute because Sean's cute. Ugh, sorry, guys.
And maybe the doctor's, just giving me information to be overly cautious. Maybe I'll go to the maternal fetal specialist and they'll say, oh, I don't know. I just can't imagine that they'll be like, oh yeah, it's totally safe. Like if the doctor is like saying to me, no matter what the testing says and your probability says of safety, he was saying it's high risk. It will be high risk no matter what way, what happens, So it's just like, I don't know. I guess I'm happy about the fibroid and that not being a concern. It's just hard. I'm scared, like how much risk is the risk I want to take? I'm scared about the risk, I'm scared about like, I'm just scared. So yeah, that's sort of where it's all at right now. They will be making the appointment to maternal fetal medicine, and he was also saying like, he was pretty much saying like, I would have to have some testing done, but I've actually already had the testing done, so that's really good. I had like a full cardiac workup. I don't have to go see my cardiologist for a while. He's like, my cardiologist was pretty much saying like, I have some issues with my heart, but they're overall like okay-ish right now. And like down the road, I'll have to possibly look into, some different things like if the valves deteriorate. But at this point things are okay. And but I had, they looked at the size of my aorta, because that's like the one big thing he was saying. It's about the structure of your heart, like the structural integrity of your heart, I guess you could say, like how it functions, and then also the diameter of your aorta. And I think the larger the diameter, with this specific condition, the more risky it is. So I know when I went to the cardiologist and got the results of the scan of my aorta, he did say that my aorta is slightly enlarged, but I don't know what that amount is. I don't know the specific number. I don't know. It's just scary, and but even though he said that my aorta is slightly enlarged, he didn't feel like there was any need for like any type of treatment at that point. That's what the cardiologist said. So that might be positive. But even then, like if I know that there's concern with your aorta and pregnancy and everything, like it's just scary. I just don't know. I don't know. I know, and I feel like I'm just kind of talking in circles with you guys right now, but that's what, that's what I feel like I need to do right now. And I just want to, I know you guys understand and are so supportive, and I don't know. Like when he said the stuff about my fibroid, I was like, okay, that's good. He didn't make it seem like it was impossible, and he was saying, like I'm not a specialist in that particular field in like maternal cardiac health. But he's like, I can give you information on it. I don't know. It's just scary because like you just hear high risk, and I'm scared to even think about like to weigh pros and cons of like level of risk. Does that make sense? Like I'm scared to say like what level of risk am I willing to take? Does that make sense? And also like what is the likelihood that the baby would have a heart defect as well? There's just a lot, so. I don't know, guys. I'm just feeling really scared and upset and disappointed. I wonder if the doctor was just like giving more information just to be like overly cautious, like maybe he was just presenting everything in a way to just like stress the importance of concern. Hold on a second, guys. So Sean is so sweet. He just called me, and he actually just got us tickets to go see a comedian. He actually just surprised me with tickets to that tonight, and he's so sweet. Like, I just love him so much, and he was like saying to me, Sean was like saying to me, you know, like to not, you know, be upset with myself because, you know, I feel like I'm preventing something from happening, you know, but like I feel like, you know, like he can't have, you know, a kid because I might not be able to, you know, like I feel like I'm keeping him from doing something. I'm really sorry that I'm so emotional right now. I feel like it's just a video of me crying. I guess I should probably stop filming so I can stop crying. Try to calm myself down, I guess. So thank you all so much for listening and your kindness and your encouragement, and I will definitely let you guys know what's going on and, you know, let you know how the appointments go. And yeah, so thank you all so much for watching, and I will talk to you in my next video. Bye.